what was interesting about the study is as we interviewed people from different divisions who see different kinds of patients, it turns out the themes are all kind of the same. And it's always very reassuring to see things that you struggle with reflected back by other people as well. Really, the themes that we found were quite well encompassed by the original 6 themes laid out by the American College of Surgeons ethics group. But the sort of shift away from the confidentiality issue, for example, and the informed consent issue really suggested effective education and policymaking around those issues, and, then left a even more obvious gap around complicated end-of-life cases, for example, complicated interpersonal relationships, that kind of thing. I think the complexity of medical care has made these issues come up more, particularly around surgery. We have more interventions that we can offer. Patients are kept alive longer, particularly when we're talking about futility at the end of life. There's just, I think that has grown exponentially just because of technology and our just general advancement in the surgical world. So I think the idea that we are having more issues with futility or disagreements over care, or even disagreements among colleagues, is because there are now so many ways of dealing with a problem.
There are aspects of ethics that are very specific to rendering surgical care that are different from other areas of medicine. Surgical ethics isn't a completely separate field from medical ethics, but it is sort of a subset of medical ethics that is a little bit different. Obviously, there's lots of overlap. My sense is that there's no group that speaks for the world of surgery other than the ACS. And so that's why it seems to me that the ACS is the perfect organization to say, let's put a stake in the ground and say, this is basic minimal curricular requirements in surgical ethics, and everybody should get exposure to this. These are issues that everybody ought to be conversant in. Everybody ought to know that they are challenging, that they require a lot of thought. The more there's discussion of ethical issues in the college, I think the better it is for all of surgeons.